as somebody who's been a dental practice management consultant for almost 20 years now, I really live by the numbers, and the numbers tell me a very specific story on how a practice is operating. It also tells me an even more granular story on how each individual is operating within the practice. And, when we look at the difference between metrics and KPIs, we're going to have a good understanding of what we should be putting our attention and then the intention to make sure that we're mastering how we utilize those metrics on a day-to-day level. Not only that, how do we get our team to understand why we're looking at metrics, not just because we want and I got you. So as we look at today's webinar, we're going to take a 30,000-foot overview of why metrics and KPIs are important in terms of managing a practice. We're going to look at how to analyze those dental metrics, how to use metrics strategically. We'll talk a little bit about case studies and best practices, and maybe I'll talk a little bit about bonus, and then how to create accountability with the team using those KPIs. So we will get started. All right. Now, if I can get the screen to move, even better. All right. So when we look at metrics in dentistry, there are three types of people when it comes to actual data analysis. Now, there's the person who knows how to get and present the meaningful data. In other words, I went to Dentrix today and I pulled a report on cancellations. Or I went to Eaglesoft and I pulled the number of emergencies that we had this month. That's pretty much it. So yeah, we know how to pull the report. Okay, then the other person, the second type of person, is the person who knows how to analyze and interpret the data. Okay, I pulled a cancellation report. We had 563 patients this month, and we had 160 cancel, which is a 20% ratio. Great. Okay, so we know that. Okay, now there's the third type of person, the person who understands the first and the second person, but then what do they do about it? So in any business, there are those are the people who make the greatest impact. So if I'm looking at a cancellation report and I see you have a 20% cancellation rate, my next step would be, let's come up with a strategic plan on how we're going to work on decreasing the cancellation rate. And we're going to do it as a SMART goal business, because in any size business, you want to use SMART goals. And for those of you who don't know that acronym, which I know most of you do, it stands for strategic, measurable, attainable, results focused, and time bound. So we don't tell a team, oh, we need to drop our cancellation rate by 10% in the next month, because I don't know what team would be able to do that. It's impossible. But what we can tell the team is we're going to drop the rate from 20% to 17% in the next 90 days by incorporating more scripting into our day-to-day repertoire with our patients, making sure that patients understand there are consequences for canceling their appointment. It doesn't mean we're going to charge them $100 every time they call and cancel, but we need to put a little pain in there, because as a business, you still need to hit the bottom line. And this is where, now that we understand the data, we know how to analyze it. Now, what do we do about it? And that's what most of what we're going to talk about today is all about. So, difference between a KPI and a metric. We're going to look at that more specifically in a minute. We're going to talk about implementing, 5 to 7 clear KPIs as a best practice for enhancing strategic planning. And again, when we look at a practice, or when I specifically look at a practice, I look at a lot of numbers. I look at P&Ls, I look at balance sheets, I look at, a couple of years worth of data in terms of historical history in the practice. And all data is a little different, and how you all track it and how you all interpret it and look at it. And we're going to go a little bit further into that as we go. But what are some really clear KPIs that we want to put together that we're going to hold our team accountable to in order to make sure that we're hitting the areas that we need to hit and improve upon over time? And it's not going to happen overnight, just FYI. Creating those clear, actionable insights. What systems and structure do we need to put into the day-to-day of the practice as we look at those KPIs? Earlier, I mentioned cancellations. Now, I go to a lot of practices, and actually I'll use late patients as an example. Late patients also result in cancellations. And sometimes when I ask the question, what is a late patient? I get about 10 different answers from 10 different people. And so we all have to make sure that we have a system in place and we're putting the structure behind it so that the interpretation of what that system is being utilized for the majority versus the exception. And there's always going to be an exception to the rule. And then when we look at this, it's what is our healthy and unhealthy budgeting? So as we look at metrics like production and collections, what's going to be healthy for us in terms of creating sustainable growth? And if we want sustainable growth year over year, we need to make sure we have the right KPIs in place that we're putting attention to day in and day out. And those KPIs can change over time. So they're not always going to be the same. So when we look at the importance of metrics in a dental practice, a metric enables a dental practice to make those data-driven decisions. It's creating more accountability. It's enhancing patient care. I mean, at the end of the day, this is what somebody like me as a dental consultant cares about is what is the outcome for the patient? How is the patient reacting to what you're telling them? How is the team actually engaging with those patients to make sure they're getting the best possible care that they need, or else they wouldn't be going to you? So if we have accurate metrics, that can lead to, again, the increase in efficiency, the improved patient satisfaction, and then looking at creating better financial performance. And I know there's a lot of, offices out there that don't want to put a lot of focus on the finances sometimes. I'm not saying everybody, but I tend to get a little bit of an objection in terms of sharing numbers with teams, but they all know. They know how much you charge for a root canal. They know how much you charge for a crown. They know what's an appointment cost. Okay. At the end of the day, their knowledge is going to be more powerful for you in understanding those things. I'm not telling you to share your salaries with them, but what I am saying is share the bottom line data that you're keeping track of to actually enhance their performance and motivate them as a team. So when we look at the overview, in terms of KPIs are your key performance indicators. And it's super important to distinguish the difference between a metric and a KPI. The terms tend to be used interchangeably, but they're not the same exact thing. So a metric, like I said earlier, provides that quantitative data that enables organizations to assess performance and make informed decisions. It has general measurements that are used to track various aspects of the practice, number of calls received, the number of new patients, number of procedures performed. But they provide the data of what's actually happening in the practice. So if I'm trying to figure out, what is our success with a new patient calling on the phone? Okay. Now I could say to my front office, I want to have, 20 new patients in the office. That's a metric, and, in order to get that, I have to have, let's call it 40 new patient phone calls because, the KPI is what's the conversion of that new patient phone call. So if our conversion rate's 50%, I need 40 new phone calls to get to that 20 new patient number. And hopefully that makes sense to everybody. But the number of calls or complimentary consultations would be the metric. And like I said, the KPI is the percentage of the visits resulted in a new patient phone call. So like I said, new patient conversion. Okay, so when we look at a key performance indicator, that's the specific measurable value that's critical for a business, unlike a general metric. So retention percentage, perio percentage, treatment acceptance percentage. That's going to give us a real clear idea of what needs to happen, to get us to a certain goal. Now, those clients who do work with me, I've given them several goals to achieve. Everything from the collection to production ratio all the way down to case acceptance percentage number, and even cancellations. And when we look at those metrics, we're holding the standards of those KPIs to say, this is what we're putting our focus on as a team. When we're having issues that the schedule is empty, we're going to try to understand why is that schedule empty, and we're going to reverse engineer everything that we're doing based on that KPI. So if we know that we have to hit a goal of 98% collection to production ratio, well, I'm going to start asking a lot of questions of a practice to say, are we collecting over the counter? Are we doing too many write-offs? Do we have other available options for financing for patients? Okay, what are we doing in order to collect the money that we need to collect so that everybody is getting what they need and you're achieving your KPI metrics itself? And I'll go into this a little bit further. So production and collections is a metric. Okay, KPIs, again, key, the collection to production ratio. Okay, my recommendation is that you're collecting 98% of what you produce. Okay, and if it's well below 98%, we want to ask, some questions of ourselves of making sure, how are we making sure we're collecting that money? Are we doing too many predeterminations before a patient, says yes to treatment? So what is our philosophy in this practice? Is the philosophy that we want to, make sure that the insurance is going to cover it? Or is the philosophy that we need the patient, or we want the patient to accept treatment because they need the treatment? And we'll figure out a way to make it fit into their budget. Okay, so there's a lot of different philosophies out there on predeterminations, but in most cases, it's something that I would say it's based on the need of the patient versus the need of the insurance. Okay, our retention ratio. Now, this can actually vary, from place to place. Living in a city like Phoenix, Arizona, we are a very transient community. And sometimes that retention ratio can range anywhere between 75 to 80%. And I would say a good ratio of retention is about 90% or higher. And, other communities that are a little bit more rural based, are going to be in those 90%. And if you start falling below that, now we have to create strategy around how do we get that retention number to increase? Why are patients not coming back for an appointment? Was it, that they didn't see the value from the hygienist, before they left and just see it as a cleaning? Or is the front office just saying, oh, you need to cancel your appointment? Okay, no problem. Let's go ahead and reschedule it, or you could call us back. Now, this isn't a finger pointing situation here. This is more of a fact-based situation. And, we know when we have these outstanding patients who don't have treatment scheduled, we start asking ourselves questions on why, and we want to make sure that we're understanding that so that we're creating a strategy around increasing or decreasing that number depending on where we want to go, like cancellations. Okay. Again, do we let patients just call and say, I can't make my appointment? Can we reschedule? Do we have rules in place for that? Do you have a first, second, and third strike rule before you say, you know what, maybe this isn't the right office for you? And that is okay. You can totally tell your patients that because it may not be the right office for them based on your philosophy and your vision for this practice. So be okay with the fact that you might lose patients in the process because they don't want to follow suit with what some of your goals and visions are, but what we want to do is make sure we have the right patients in our practice who are going to do the dentistry that you want to do on them. Periodontal percentage. Again, this one is a floating number, in most practices, it depends. But, I will say that I've probably seen a lot of these numbers on the lower ends. I've had teams compete with other teams on their percentage of perio getting higher because their philosophy was a very perio-based philosophy on the hygiene side. So if we know what is our perio percentage needing to be, everything from that 43, 41, 43, 42 to the debridement codes, what should that look like? And then getting them back into that 49-10 mode. Are we just letting it go because, well, we don't want to, upset a patient saying you need perio versus a prophy, and we know the perio is going to be more expensive and your insurance doesn't cover it. Okay, so again, these are the questions that I myself would ask a practice as I'm having these conversations with the doctor and the team. And then the number of days scheduled to goal. Now, when I start working with a practice, and all of you who run practices, I'm sure you have a growth goal year over year. And that growth goal can be anywhere between, most practices grow this according to statistics I saw, grow anywhere between 1 to 3%. Practices, also grow anywhere between 10 to 20%. And it all depends on how you operate that practice. But, part of that is looking at if we're going to have 10% growth year over year for a practice that's probably been in place for about 10 to 15 years, and is maybe like hitting that plateau a little bit. Great. Now, what do we have to do? How many days do we need to be scheduled to goal so that we can maintain that sustainable growth of 10% year over year in our practice? Now, one thing that, I have been doing and using, and some of you actually do utilize analytics. I love analytics. I'm a nerd, and I love looking at numbers. And, we actually have partnered with Dental Intelligence, which would benefit all of you as clients. But for me as a consultant, this gives me a really good view of how my practices are doing over time, or how they've been doing before I even start working with them. It's going to give me very specific KPIs that I'm going to look at, that I'm bringing back to them on a monthly basis to say, what did we do here? What did we do well? Where do we need to improve? So much so that the team is getting engaged with it. The nice part about, having Dental Intelligence or Jarvis or any other, software you might use is that, Dental Intel actually gives you the ability to create scorecards. And those of you who've been on any of my former webinars, I talk about role scorecards. And role scorecards also fall into, are we hitting certain metrics as a hygienist, as a dental assistant, as a dental associate? And making sure that, we're tying some key performance indicators to those individuals so that they know what they need to go after specifically. And what does it do? It affects the bottom line of the practice. Hopefully this makes sense to everybody. But you can see here with one of my practices that I'm working with, this is still pretty new to them and me, is looking at, and this is only like one piece of their scorecard, but, where are we sitting at with productions, adjustments, collections, everything all the way through new patients and case acceptance. And then I even broke it down further, because now that each team member has a specific role scorecard for them, now they're going to have 2 or 3 metrics specifically tied to them based on what we're working on in the office. And so that's something that, anyone, whether you're using Curve or any of the other analytic platforms out there, or if you're tracking your own numbers in Excel, which I appreciate too, you have the ability to start, making those, I'll call it assumptions, but very clear assumptions based on the numbers that you're looking at. If you've dropped insurances, you should be seeing your collections increase, hopefully. Okay, you should start seeing a change in your production and your productivity. So any one of these things could be helpful to a practice as they're motioning through their day-to-day. Okay, so now that we hit that, let's talk about analyzing dental metrics. So I'm going to talk a little bit about leading versus lagging indicators. A leading indicator is a predictive metric that can provide insight into any future outcome. A lagging indicator are outcome-based metrics that confirm past success or failures. So when I use an analytic dashboard of some sort, I'm using a leading indicator. I'm able to start seeing ahead in the future, how well have you scheduled your week out? So when I tell a team that you're going to do a morning huddle, and of course, we're going to talk about today being the most important day, but on top of today, we need to start talking about the next 10 days to see what openings do we have, because people who are coming in today with outstanding treatment need to get scheduled in those 10 days. We're creating a little urgency. We're putting some, work into getting the rest of the schedule filled without having to make the scheduling coordinators run around like chickens with their heads cut off to just fill the schedule. And remember, you don't want to try to do everything today, because at the end of the day, why try to do more when you already have a full day? Get them back into the office, and then you have the right scripting in place on why you're telling them to come into the office on a second day. Okay. So when we look at leading indicators, it allows us to proactively adjust and improve performance. Lagging indicators confirm basically fact. Okay, we could look at, a spreadsheet, and I used to do this in the very beginning of my consulting career. I would get spreadsheets from every single one of my clients. I would get them on the 7th of the month. There were about 10 different sheets in the spreadsheet that it was getting filled out by office managers or doctors. And basically, we're already like 7 to 10 days into the month, and I'm looking at last month, and what good was it? It just showed me what was going on. And I was able to, adjust any recommendations I would make around it. But now I can actually look at a practice and say, hey, your current retention rate is sitting at 82%. Let's create a strategy around that and get you to 85% in the next 90 days. Here are 5 things that I'm going to ask you and your team to do, or 3 things. I don't like to give you more than 3. Okay, so when we look at that leading indicator, we have a predictive, actionable, format that we're looking at. What's the future outcome that we want to look at? What actions do we need to make? Whereas the lagging indicator is just giving us focus on, areas that we need to improve. Both are valuable. Don't get me wrong. I don't have a problem with a lagging indicator. But, the leading indicators are going to be more useful for you to make informed decisions and preventing any negative outcomes. So those of you who don't know me very well, I'm very much on the boat of being more proactive versus reactive. I have some of my own team members on here from Dawson. They know all about it. And, what we tend to look at, are let's look at months ahead. Let's look at weeks ahead. Let's make sure that we are, in essence, seeing what's coming so that we can prepare ourselves for that versus, oh, wow, this is happening in a month. And what do we do? So gives us a nice dose of reality of, making sure that we're practicing what we preach to you. Okay. So when we look at those types of metrics, and I talked about a few of those metrics, we look at common metrics like production, patient flow, treatment acceptance rates. How do we gauge, the different facets of practice performance? One that I always like when I'm speaking with a team or a doctor or multiple doctors and office managers, it's the question of why are we meeting our goals? And I'll give you a little case study. I worked with a team down in Florida. They weren't part of Dawson. This is a long time ago. But the doctor actually came to me and said, my team's really upset with me because they're not getting their bonus. And so my question was, my statement back was, well, they're not hitting the financial goals that we set. And then we, had a further discussion, and we did a team meeting, and all of a sudden we started looking at the schedule. And in the schedule, we were seeing that, or my first question to the team was, are you following your template? And I was silent until they all answered. Well, yeah, we're following the template. Okay, great. Now let's look at the data. And we looked at the first quarter of the year. They didn't hit in January, didn't hit in February, but hit it in March. Okay, but because they didn't hit it for the quarter, they didn't get a bonus. So then again, my question was, are we following the template that we set to hit our financial goals this year? Well, yeah, I think we are. Okay, great. Now let's look at quarter 2. Same exact pattern. Didn't hit it. Okay. And again, my next question was, are we actually following the template? And finally, somebody said, no, we're not. And it wasn't that I was trying to prove myself right, but what I was trying to get them to look at is their own responsibility and accountability to fill the schedule productively, which is why we created a template. Okay. Another reason why a practice isn't growing. If we have a 1 doctor 2 hygiene practice with 560 appointments in a month over a 20-day period, let's say 112 of those patients didn't show. They canceled or they didn't show. It's 20%. 67 of those patients were hygiene visits, and let's call that hygiene visit $200. Okay. And 45 of them were doctor restorative visits. And let's just say the doctor's hourly production equates to about $650 an hour. So what lost production did we have based on those numbers? About $43,000. Then I go back and ask everybody, why do you think you didn't hit your production goal and we missed bonus? And again, this isn't for me to, tell a team that they're wrong and they're bad. This is for them to understand and realize that every single time we have a patient canceling, that's actually going to affect how we hit our goal toward the end of the month. And I see patterns with teams where sometimes they're doing great during the entire month. Sometimes they start off really slow, and then about midway through the month, they start, kicking into gear. And then sometimes they're really slow, and then by the end of the month, they're working like crazy because they know they have to hit a goal in order to achieve some sort of bonus metric. So there's different ways that we could look at these metrics and then influence the team as we move forward. Okay, so tools for tracking metrics. Like I said earlier, there's a lot of analytic software out there. I know even some of the dental practice management softwares out there have their own version of analytics. Everybody has a different amount of robustness to, I don't know if that's a word, to how they look at their analytics. And like I said, we partner with Dental Intel. I know they have about 7,000 clients, dentists who use them. And, for somebody like me, I love looking at these metrics with my practices to actually determine the level of success that they're having. And it's more of a, accolade to them that they are able to start looking at these and create their own story from what they're looking at. So when we look at, some of this data here, I can start looking at it and see, how many appointments, did we have on the day-to-day level. Now I can even go and double click on this further to actually look at their schedule and how they're scheduling their appointments. I can see where the new patients are sitting, what that production looks like, is the new doctor getting those new patients? Are they going into hygiene? How is it being done? To looking at, are we hitting our daily production goals? And in here, and this is actually one of my clients, and I have set very specific production goals for all providers. So hygiene has their own, the associate has his, and the lead doctor has his. Okay. Unscheduled patients. Guess what? This is an opportunity for this practice. This is telling me that we have 1,100 unscheduled patients with about $600,000 in opportunity, almost 700,000. Now, I'm not telling them to call a list of 1,000 patients all in a matter of a week. But what I am going to do is give them a strategy around calling some of these patients, starting with patients who are 6 months and a day overdue for hygiene that don't have a scheduled appointment. Okay, so it's going to give them a strategy where we're not talking about quantity, we're talking about quality of calls. And I'm going to give them scripting in order to, say the right things. Everything from how do we leave a message for a patient? And I can't tell you how many times I've listened to phone calls in a practice and I hear, oh, can you give us a call to schedule your dental appointment? If you want, give us a call, in the next couple of days so we can get you on the schedule versus, hey, I'm calling from Super Smiles and we're really concerned about your overall dental health. Give us a call. We're here until 5 o'clock today. My number is blah, blah. Okay, so there's a clear difference on how we actually talk about that with patients and how we train our teams in order to do that successfully. And if we take it even further and double click even further, looking at restorative, elective cases, what's being accepted. Now, case acceptance percentages vary from practice to practice. It varies from doctor to doctor. Now, I have two doctors in this practice. One doctor does full mouth rehab. So his case acceptance is probably in the 40s. Actually, I know it is. Okay. And then there's, the associate who is brand new. He's seeing the small cases. He's starting to do the bigger ones because the owner doctor is mentoring him. But, I would say his case acceptance, should be around 80 to 85% because he's doing more onesie twosie type of dentistry. So it's just a variation based on percentage. I actually like looking at the case acceptance value number versus the percentage. So again, if we're doing higher level cases, we're doing Invisalign, we're doing implant surgery, we're doing full mouth rehab, your case acceptance value should be much higher than some fillings in a crown. Okay, so you start determining what that actually looks like based on historical. Hygiene case acceptance. How good are we with our hygienists to actually get patients to say yes to their hygiene needs? Okay, so when I go and observe a practice and I am in a corner and some people don't even know I'm actually standing there and listening to everything, I'm listening to how a hygienist pre-presents to a patient whatever they're seeing on photos, on x-rays, anything. Now, they're not diagnosing because I know legally they can't, but what they are doing is observing what's going on in a patient's mouth by the photos, the x-rays, the perio charting, what have you. And they're making possible recommendations that the doctor is going to come in and confirm or make a different recommendation. Now, the key here is how is that team working together so that when that handoff actually happens between the hygienist and the doctor, it's a very clear handoff in front of the patient for the patient to understand the value of the needed treatment. Okay. And the doctor is going to go in and hopefully confirm whatever that hygienist recommended. Okay. And then they walk away, and guess what the patient's going to do? They're going to turn to the hygienist that they've been seeing for years, and they're going to say, do I really need that crown? Because my tooth doesn't hurt. Now the hygienist has to be really good at, convincing the patient the real need for that crown, even when it doesn't hurt, or the need for the SRP, or the need for the root canal, before we have to pull that tooth and make it an implant. Okay, so do they understand and can they relay problem, consequence, and solution effectively to a patient once the doctor steps out of the room? Not only that, handing it off to the treatment coordinator or the front office for them to get scheduled. So we look at all these things. New patients, again, what is our new patient rate of coming in? How many of them are actually reappointing into a new appointment? And making sure that, every single patient before they leave the office, and again, here's another KPI, 98% of those patients should be walking out with an appointment. Now, I've been in situations where I hear, oh, dad brought in the kids and he doesn't know the schedule. Again, you could still create a temporary appointment, so that no one's walking away. Now, we're going to talk a little bit about integrity of data, because as you can see here, there's nothing for cancellations and no-shows. And this doesn't mean this practice doesn't have cancellations and no-shows, because they do. But, when we talk about data integrity, it's about, it's the whole adage, garbage in, garbage out. Okay, so the garbage in, like whatever we're putting in, we want to see the right output. And we're not saying put in garbage, but what I am saying here is that we want to make sure if we're using any analytical data or we're pulling reports that we're just putting in an Excel spreadsheet, make sure we have the right data that we're looking at. And, when we do that, especially with an analytics dashboard, we want to make sure that we're really good at how it's being inputted into our DPMS so that we're getting the right output. So again, we can make that predictable strategy, based on what we see in the data itself. Hopefully that made sense to everybody. Okay. So now let's look at data collection and accuracy. I just kind of already talked about it. So what is the accuracy of what we're actually looking at? How do we use those numbers? How do we make sure that we're getting the reporting that we need to get in order for us to make the changes? I've been in offices and I've pulled out of multiple different softwares, things like, case acceptance numbers, patients who walked out of the office without, accepting a treatment plan. I've pulled, and as I pull these reports, no one really knows and was in shock, basically, of what I was pulling because they never looked at it or they never talked about it. And that's the whole point of having your team meetings, is that you were taking a part of your team meeting to actually have a very clear discussion of how do we grow the business? How do we make sure our patients get what they need? And make sure that we're also doing what we need to do in order to keep growing as a business, because any business can go away at any point in time. So we want to make sure that we're looking at the right measurements in order to get there. And as we look at interpreting the data, for the necessary insights we have, thinking about things like a new patient value. New patient value measures the financial contribution of each new patient that's acquired. Okay. This metric is going to inform us that of our marketing effectiveness and enhancing strategic planning for patient acquisition. So if we're going to a bunch of health fairs and it costs us $5,000 every time we go and we're only getting one new patient out of it, we have to understand, like, is this an effective marketing tool? Or if we start saying, hey, we're going to offer up free whitening for every new patient referral or every 2 new patient referrals that one patient sends, what is that really costing us at the end of the day? We're going to see a new patient, but we know the whitening is not going to cost us a lot of money either. So we start creating, different types of strategies around something like that with a new patient value. Treatment plan acceptance rate indicates how effectively treatment plans are being presented and received by patients. Okay, high acceptance rates suggest effective communication and trust by the patient. And again, dependent on the type of dentistry you do. But sometimes, when I get the question of why aren't patients saying yes to my treatment, one of my questions might be, have you ever analyzed or talked about as a team how you're presenting that in front of a patient? Do you over-educate and under-motivate a patient when they're sitting in the chair? And again, this is not to pick on practices I've been to, but I have, been to hundreds of practices in 20 years where I used to sit and watch doctors talk to patients about the science behind a margin or using ortho or how the implant's placed. And I could tell you right now, they don't care. They care about what is it going to do for them and, how much time am I going to have to spend in the chair to do it? Because a lot of them don't like dentistry. So are we motivating them to get it done? Are we motivating it to get it done in a more urgent fashion? And, is it because they need it? And then, of course, cancellations. I talk about cancellations all the time. How do we impact the practice revenue and the patient scheduling? Okay, there's nothing worse than, I feel so bad for scheduling coordinators when they walk in and they listen to that voicemail in the morning and there's 3 voicemails from patients who called at midnight the night before to cancel their dental appointment the next day. And it happens constantly. Okay. And, with that, now they're trying to figure out, oh my God, the doctor is going to be really mad at us and the schedule is not filled and we're not going to hit our goals and we're not going to make our numbers and not hit our bonus. That's what's going through their head, on top of the fact that they have to do about 15 other things in the front office, like verify insurance and check patients in and check them out, etc. So now what do we do? What is the strategy to understand the reasons behind the cancellations to improve both retention and the patient commitment? Okay. When I hear the word cleaning, I want to put a quarter in the jar every single time, and I'd probably walk out with about $100 by the end of a day, an 8-hour day. And it's not a cleaning. And we all know it's not a cleaning. What is that commitment that we're, telling the patient what they're getting? Those things, those little verbal skills that are being utilized in a day-to-day with patients actually affect a lot of your KPI outcomes. All right. We're getting to the home stretch here. So now let's look at how do we strategically use metrics? I think I started talking a little bit about this already, but making sure that we have a framework, to give us the targets that we need to give us, enhance that accountability with every single team member, and how do we improve performance based on that quantifiable progress? Okay, so we don't create these goals just to have a number in place, but I look at those goals as a scoreboard. And, scoreboard, and for those of you who love sports like I do, like I want to go to a game and I want to see the stats. I want to see how everybody's doing. I want to understand, what could they be doing better, as they, improve the game that they're playing. And that's kind of the same thing that we're doing here in a dental office. Okay, how do we look at following up on delayed care? Do we have a process to contact patients who delayed operative or restorative care? When was the last follow-up? How do we focus on patients that have been in most recently and then work backward through the calendar? Okay, so I was talking strategies with a client of mine whose schedule wasn't very full. And I gave him and his team probably about 10 different strategies to start thinking about and using. So follow up on delayed care. As we look at patients who haven't said yes, who's been in most recently? Because remember, the motivation level is at its highest from the time that they've been in your office, but it starts dwindling down the moment they leave that chair and walk out the door. So we want to look at not patients who haven't been in for 12 months, but we want to look at the patients who were here a week ago who didn't say yes, or 2 weeks ago. And what can we do? What verbiage can we use to influence them to do the treatment? And those of you ever use teledentistry, or, hey, do you want to bring in another decision maker? Do you want to do it on a Zoom meeting? So they don't have to leave the house, or that, you could do this in a quick mode with a treatment coordinator. There's a lot of different possibilities on doing that. Moving appointments up. If we have patients who are booked out for months or weeks even, and we have sudden openings in the schedule, this is when we want to, again, during huddles, consistently review the schedule 10 days ahead. So I tell every practice in morning huddle, we look at today, we look at the next 10 days. Tomorrow, you look at today, you look at the 10 days after that. So it's a consistent view to say, hey, we have a 2-hour block in Dr. Smith's schedule on the 15th. And Susie's coming in today and she has 2 crowns that need to be placed. That would be a great time for her to come into the schedule. Okay, so we're kind of making that predictability a reality. Unaccepted treatment plans. So again, treatment plans, developing a strategy around quality calls. I cannot stand when I hear, oh, I made 55 calls today to a bunch of patients. Great. I bet you what those calls sounded like were, oh, I'm calling to see if you wanted to schedule your appointment. And that's not the right strategy. But what is it about the appointment? What is the pain point? How do you kind of motivate that patient to come in for the appointment that they need, that you are concerned about as a practice? Do we know how to handle potential objections, that they're going to have? It doesn't hurt. I mean, I've heard that one a million times. Yeah, it may not hurt, but guess what? When you least expect it, patient, and you're out on a weekend with your family on a boat and you bite into that salad that has a walnut in it and you crack your tooth, guess what? I'm not going to be available for you when that happens. Okay. So how do you make it sound like this is something that they need now? Identifying new patients who are ready to start treatment immediately. Now, this one's a tough one sometimes too, because, new patients, you want to build that rapport and relationship and trust. But in a lot of cases, you do build that right from the get-go with them if, that you have a great new patient appointment process. Patients who haven't had a comprehensive exam for over 3 years. Again, difference from state to state, it's anywhere between 3 to 5 years. But if they haven't had a comp exam, if you're a new dentist that just bought a practice and half the patients are coming from the old dentist and they've never had a comprehensive visit with you, this is a great thought to, open up some time if you have it, or if you have the time to actually bring them in. Okay, so there's definitely a bunch of different, strategies that you can use. When you get the end of year, okay, I usually tell every practice around September is when you want to do this. You want to do an audit. You want to look at anybody who has benefits, and you send out a letter to those patients with benefits, FSA, HSA, end of year insurance. Okay. You're letting them know, hey, we are scheduling. You need to use it. I know HSA is ongoing, but FSA, it's use it or lose it. And that's when you guys are at your most busiest, is in December, because guess what? They all start remembering that they have benefits they haven't used. But start that early to start getting your last quarter filled in, because a practice shouldn't be, seasonal in any way. It should be ever going, month over month. And, there's ways to put a lot of focus on that with those patients who haven't been in over 18 months. Okay. That's considered an inactive patient. You might start calling some of those inactive patients. You might start cleaning up your inactive patient base. Some of them may have passed away. They moved, something with those patients, or, is something that you can go off of. And then engaging your team members with the data. So making sure that, we are giving the team a heightened understanding of what those key performance metrics are. And again, I do not want you throwing 20 different metrics at your team and saying, good, have at it. But what you want to do is you want to foster some collaboration with your team to have them, even let you know what are some of the issues that you're having in the practice that we should be able to, look at a KPI measurement and start goaling ourselves against. Okay. what is the outcome that we want to have to create more efficiency in our day-to-day? And there's no better group than your own team to do that with as well. Okay, and when we look at reporting and accountability, making sure that we have a regular reporting. Again, your team meetings, if you're doing team meetings, I kind of tell you to do it once a week, but some of you do it twice a month. Some of you do it once a month. Some of you do it once a quarter. But a team meeting once a month should, dedicate a little bit of that time to the business of the practice. It should be looking at our key performance indicators of what we're trying to achieve to get to the metrics of production and collections goals that we want to have. It's showing us what our standards are. And when we talk about, those bonuses and bonus structures, you're going to pick 2 or 3 KPIs that maybe for a quarter or two, you have your team put a lot of focus on. You create a tiered structure to how we get to those. So in other words, if our goal is to decrease cancellations, which are at 20%, if we hit that, 19% mark, which is dropping it, which is what the goal is, then, they hit tier 1 and they get a certain piece of the bonus pool from that. If tier 2 is 18%, they get a bigger tier. If it's 17%, they get the biggest tier of that KPI. And we don't have a lot of time to discuss that, but these are things that I discuss, pretty thoroughly with practices as I work with them. But it puts those standards in place and it creates a habit amongst the team. Now, I could care less if, they work the front office or they're a hygienist. Everybody should know and understand, what we do with a cancellation, how we communicate with them, what do we do in the case that, it's consistent. So they might not be answering the phones, but they should understand what the protocol really is. Okay. And with that, then they're changing their verbiage a little bit in the back office with patients who might have canceled in the past and saying, hey, in order for you to stay on track with your overall dental health, I'm going to recommend that you don't cancel your future appointments because it's going to really put you off track and we're getting busier in this office. It's not a great script, but you kind of get my meaning here. Okay, so overall, looking at, and I think I've given you a few case studies as we've gone along, looking at, what are some successful implementation stories? I mean, I've had practices who've increased their retention rates, by 3% in a quarter. And again, that doesn't seem like a lot to a lot of you, but 3% retention is huge because you're talking about 78 more patients onto the schedule in some cases. So that is a slow moving target as you go. And I had a practice in Ohio, which was a pretty big office that started out with their retention number at 82%. The goal was to get to 85 by the end of the quarter. And they made it just by over 0.02%. And what happened was every single week in their team meetings, they were talking about what are they doing to get those patients on the schedule? How are we making sure they're staying on the schedule? How are we overcoming the cancellations and no-shows that are coming in? And they were able to actually achieve it. And then guess what? The next quarter, they were trying to get it up a little bit more from there, but they put their focus and attention to it. Okay. With perio, like working with the hygienist, and talking about how do we discuss perio in the most productive way, not just so that we have 40% of our patients, in some sort of perio code, but making sure the patients who need it are actually getting coded to that because what is it? It's a disease and infection. It's not going away. We need to take care of it. So we're making sure that we're putting in those standards as a team so that, patients are getting the outcome they need. And you're also doing, what's in the best interest of the patient as a practice. And then as we look at those lessons, learn through the metrics, again, going back to the financial outcome, when I look at aging reports and I look at, patient value and collections, this is really giving me, the idea of if we're putting in the right measurements and standards in our day-to-day and how we operate, everything from templating a schedule to hit a production goal to avoiding cancellations in a practice, this is going to give me the outcome I want. Are we actually achieving and hitting the goal that we need to get to? And then looking at any future trends in dental metrics. I mean, again, there's AI, I love AI stuff. Predicting, tracking in dentistry. I mentioned teledentistry. I know it's not a big thing, everywhere, but, what is the shift that we need to make in order to understand how our practice needs to operate? And then again, what's the culture? Now, having a good culture in the office and everybody um, aligned with that culture is going to get you to that next level. And, those of you who have heard me speak before, I talk a lot about the vision. Is everybody bought into that vision? Does everybody understand what it is and what it stands for? And are they empowered by that vision? So if they're empowered by that vision, it's going to be important for them to be trained on the metrics because they'll be empowered by that as well. And I know everybody fears talking to their teams about the numbers, and the team starts getting that deer in the headlights look, like numbers are just foreign to me and I don't understand it. But then you have to give them a meaning to it. What's the why behind it? And again, how does it affect their day-to-day? Why are they working in a dental practice? Why are they taking care of patients? What's their why behind it? It creates a little bit more accountability to improve their own performance, and creates a little bit more of a commitment to being part of that practice as well. But all in all, I mean, I know I went through a lot in the last 55 minutes, but this is what the difference between those KPIs and metrics. I know we have a chat here, and I don't know if anyone has any questions or anything that they want to add, but I would love to hear from some of you. What reports should we be looking at as a team? Okay, I'm going to give you the consulting answer. It depends. But I would say, like if you're looking at, some specific ones, I would look at a cancellation report. I would look at new patients. I would look at retention rates. Every dental practice management software is a little bit different. There's definitely, some advice out there from each of those softwares, like YouTube videos, how to pull some of those reports. And if you are paying for the service of, customer service through them, or tech support, I would go to them and have them help you work with that, but we can talk through it as well. Staff are reluctant to keep track. I feel they want to bury their heads in the sand. Yes, they do. And I've also seen some doctors want to do that too. No offense to any of you, but yeah, the team doesn't want to because it starts putting focus on areas that they don't maybe want to be focused on. Sometimes when I come in and work with a practice, I might get an office manager who gets really nervous because they're thinking I'm going to point the finger at them, being, if their numbers aren't what they need to be. And that's not the case ever. It's more of, like, here's, it's not about blaming. It's not about finger pointing. It's about understanding how we need to operate as a business. And we want to make sure that we're operating at our highest level as a business. This is where I need your help as a team. And then we're going to create scores cards for each team member that they could put a focus on, maybe one or two things that actually affect a lot of areas in the practice. So I love these comments. This is great. What if you're in an older practice and so much work has been done and I have trouble filling my pre-blocks? How do I fill my schedule? Well, a couple different things, and this might be a longer answer too, but I know I have a couple of my own clients on here actually, and I know one of the things I've said to them, because I observe this every single time I go to an office and I watch the practice all day. The one thing that I never ever hear, probably maybe 1% of the time, is the team asking for a referral from a patient. Patient has a good outcome, they're really happy, they had a great experience, we like them, they pay on time, they come in for their appointments, they never cancel. Why are we not asking for referrals? And testimonials and reviews. Okay, it's the cheapest and easiest way to bring in new patients into the office and create a really good word of mouth for you. So this gives you an opportunity to, talk to the team. And I know this is a little bit of an icky, comment that I make when I say ask for a referral. No one likes it. But at the end of the day, when you're talking to that patient It's not, and my dentist does it to me every time because I've given him probably a couple of dozen referrals. And one of my best friends just did about $25,000 worth of dental work in his office. But, it's a very nonchalant, conversation. We love having patients like you. We would love other patients like you in our office. Here's a couple of our cards. We would, please let them know that we're taking new patients here. And, once you start getting comfortable with having, I call it getting comfortable being uncomfortable. Once you start getting comfortable with actually saying that on a regular basis, the strategy behind that is that when you're in morning huddle, each one of you on the team is picking one patient a day that's coming in that they're going to specifically ask that question to. So if you're a hygienist, you're a front office person, you're a dental assistant, you're going to be with that patient, even the doctor, you guys have to ask too. You should be targeting at least one or two of those patients a day. Now, again, we don't want the patients referring of the patients that we don't like and who cancel all the time and who aren't paying you. We want the good patients. Like, I'm a good patient. I've canceled once. Don't cancel my appointments. I come in on time, I pay, the whole deal. And so my office loves when I send them referrals because I'm sending them people like me. And that's really where you want to put some of your target, to the increasing that number so you can fill in some of those pre-blocks. Hopefully I answered your question. And then finally, what is the top system or change you've seen made the biggest impact on patient retention? I mean, really, it's really about communication. I mean, I can't tell you how many times I'll ask a hygienist, what do you do when you have that opening in your hygiene column? And I get, oh, we sharpen instruments or we fill the hygiene goodie bags. It's not the answer I want. And, in terms of patient retention, if they have an opening in their schedule, guess what? I'm getting them on the phone and I want them calling their patients to get them back on their schedule. It should not be the front office person doing it if they don't have to. If the hygienist has the opening, they should be doing it. The flip side of this too, patient retention, is what is the value created behind the appointment? So if a patient's coming in for a hygiene visit and, we keep referring to it as a cleaning and we're just doing, polishing their teeth and, we don't really explain what those perioprobing numbers mean and the bleeding points. And it's just another appointment. Again, they go and schedule that next appointment and then, oh, wait, guess what? It's a really beautiful day out. I don't want to go to my hygiene appointment. I'd rather go on the boat or I'd rather go golfing. And they're going to cancel it because it's just a cleaning to them. And if the insurance pays for it, it's even less of a value for them. So it's about the verbal skills that are being utilized, from the back office to the front office. So when I look at retention numbers, the patient retention, when I used to use a different analytic dashboard, would sit under the hygiene component. And what was funny is the hygienist would get like very hyper focused on it and feel like they were getting blamed for the retention being low. But at the end of the day, I would start looking at the cancellation rate and I'm pointing the fingers at two places. The hygienist, because are they building the value for the appointment, but the front office and how quickly they're letting the patient out of their appointment. Are they putting some parameters of, oh, you can't come into today's appointment or tomorrow's appointment, just to let you know, we do charge $100 for a missed appointment. So this is the first time, I talked to Dr. Smith and he's going to waive it today. And when you start protocols like this, if you haven't done it before, I wouldn't say start off the bat that way, but you start slowly, retraining your current patients on the type of protocols that you want to put in place. And every new patient coming in, you're going to have those discussions and you're never going to use the word policies. Don't use it. But what you're going to do is make sure that those patients fully understand the why. We don't have another opening for 6 to 8 weeks. Now you might. And you're going to put them on a call or a will call list, but we're not going to tell them, oh, if we have another cancellation, we'll give you a call. Why? It's creating a behavior. You're letting them know, oh yeah, patients cancel all the time. So if we have a cancellation, we'll call you. So there's a lot of psychology behind, the schedule and how you're actually presenting that to a patient. And that's where retention gets impacted the most. Hopefully, Dr. Briggs, that helped you.